In this film, the application of a mallet finger splint, a flexion-restrictive splint of the distal interphalangeal joint, will be demonstrated. In this case, the patient is presenting with a rupture of the extensor digitorum tendon at the level of the distal interphalangeal joint of the right second digit. This is also known as a mallet finger, a deformity in which the patient is not able to actively extend the distal interphalangeal joint. The following materials are needed for this procedure. A mallet splint of applicable size. It is advised to choose a splint which fits well and does not constrict. Bandage scissors and medical tape. In this case, size number 3 is used. The mallet finger splint is applied with the opening facing upwards, so the nail is still exposed. The distal interphalangeal joint is now not able to flex. The opening on the palmar side prevents immobilization of the proximal interphalangeal joint. Medical tape is used to fixate the splint onto the skin. Care is taken to ensure that the splint is fully connected to the skin on the dorsal side, as this causes maximum extension in the distal interphalangeal joint. The tape covers both the splint and the skin sufficiently.
Again note that the proximal interphalangeal joint is not immobilized. In case a mallet finger splint is not available, the distal interphalangeal joint can be immobilized in an extended position using tape.
This is, however, a less effective immobilizing method, so if a mallet finger splint is available, using the splint is preferred. A piece of tape of approximately 8 to 10 centimeters is used.
The tape is applied on the palmar side of the digit, just distal to the distal interphalangeal joint.
The tape is then placed over the tip of the digit on the dorsal side, while keeping the tape under tension, and is fixated. The redundant tape is removed. Note that the tape on the dorsal side extends over the proximal interphalangeal joint. A second piece of tape is used to fixate the first piece. The corners of the tape are removed, creating a rounded fingertip. Note that flexion in the distal interphalangeal joint is limited, but is still slightly possible. Therefore, the mallet finger splint is preferred over using tape only, as even slightly flexing the digit interferes with recovery.
It is important to advise the patient to maintain the extended position of the distal interphalangeal joint, even when replacing or changing the splint or tape.